Welcome back, everyone. We're diving into a really interesting area today, anti-anxiety medication.
Always a hot topic, that's for sure.
Yeah, I'm really excited to unpack it. We'll be taking most of our insights from the ninth edition of the Handbook of Clinical Psychopharmacology for Therapists.
It's a fantastic resource, really digs deep.
For sure. So we're going to cover how these medications work, any downsides to watch out for, and maybe even some unexpected bits of history.
Looking forward to it.
Me too.
Yeah?
Okay, let's start with a little history lesson. Before the benzodiazepine boom, what were doctors using to treat anxiety? I know the book mentioned things like barbiturates and meprobamate.
Yeah, you're right. It's kind of wild to think about it now, right?
True.
Remember those old movies like film noir from the 50s?
Uh-huh.
Some of those old medications like meprobamate, they just sound like straight out of one of those. They were effective sometimes, but definitely came with a higher risk of side effects. Dependence, too.
Yeah.
And then, boom, benzodiazepines enter the scene.
Like a breath of fresh air.
Totally. Safer, more effective.
Valium, Xanax. Those names are practically household terms now.
Yeah, that's right. They've become pretty ubiquitous.
So can you explain the science behind them a bit? Like what makes benzodiazepines so effective?
Okay, so picture this. Your brain's got all these circuits, right? And they're constantly firing.
Like an electrical storm.
Exactly. Now, when those circuits get too active, kind of like overwhelmed, it can trigger anxiety.
Makes sense.
So GABA, it's a neurotransmitter, and it acts like a volume knob for your brain. It chills things out, you know?
Oh, I see.
And what benzodiazepines do is they kind of like crank up that volume knob. They boost GABA's calming effects.
Wow, that's a really clear way to put it.
Thanks. It helps to visualize, right?
Absolutely.
Yeah.
So this calming effect, does it target specific parts of the brain?
Definitely. One of the key targets is this area called the limbic system. Think of it as the emotional control center of your brain.
Oh, okay.
It's where those feelings of fear and anxiety originate, and benzodiazepines can kind of like dial them down.
Like turning down the thermostat on anxiety.
Exactly.
And they work pretty quickly, don't they?
Yeah, that's another reason they're often prescribed for. Like acute anxiety, within 20 to 30 minutes, you'll usually start feeling the effects.
That's pretty fast. So we know they work quickly, but how long do they actually stay in your system? I've heard the term half-life used a lot with medications. What does that even mean?
Half-life. Yeah, it's super important when you're talking about medication. Basically, it's the time it takes for half of the drug to be like flushed out of your body. It can really impact how often you need to take a drug, potential for side effects, that kind of thing. Longer half-life means less frequent dosing, which can be super convenient.
Gotcha. So someone taking a benzodiazepine with a longer half-life, they might only need one dose a day.
Yeah, exactly. Like diazepam, for instance. That's a longer half-life benzodiazepine. Less frequent dosing is a plus, for sure. But there are also some, well, potential downsides, right? Like imagine if it builds up in the system.
Oh, yeah, that makes sense.
It's definitely something to consider, especially for like older folks.
So what about benzodiazepines with shorter half-lives? What are the trade-offs there?
Well, you're looking at more frequent dosing with those, higher risk of dependence, potentially. And get this, one of the side effects can be temporary amnesia.
Whoa, amnesia. That's pretty wild.
Yeah. Some folks actually report forgetting what happened after they took the drug.
Definitely highlights why it's so important to understand the specifics of different benzodiazepines.
For sure. Each one has its own kind of personality.
Like the effect, how long it lasts, the potential side effects, all that.
Exactly. Valium, or diazepam, like we talked about, that's a longer half-life one. Xanax, or alprazolam, has a shorter half-life.
So it really comes down to matching the medication to the person, right? Like finding the right fit.
100%. It's not a one-size-fits-all kind of thing. And then you've also got your atypical benzodiazepines, things like Ambien and Lunesta. They're really popular for sleep issues.
Oh, right. But those are the ones with the weird side effects, right?
Okay. Yeah, the sleepwalking munchies. Definitely got to watch out for those. So we've talked about how anti-anxiety meds work and some things to watch out for.
Yeah, like that whole amnesia thing. Pretty wild.
Definitely. But I think it's important to understand why these medications are prescribed in the first place, you know?
Yeah, good point. It's not just about masking symptoms, right?
Exactly. They're often used to address underlying conditions that contribute to anxiety. Like, think about adjustment disorders.
Adjustment disorders.
Yeah, they happen when someone's having a tough time coping with a major life change, like a divorce or job loss.
Ah, so the anxiety is tied to a specific event.
Exactly. And then you've got phobic disorders, which are those intense, irrational fears of specific things. Spiders, heights, public speaking.
Yeah, those can definitely make life difficult.
No.
But wouldn't avoiding those situations just make the anxiety worse?
You're hitting on a really important point there. Avoidance might feel good in the moment, but it can actually reinforce the fear, makes it tougher to manage in the long run.
So facing those fears, even though it's scary, is key. What about panic disorder? That sounds pretty intense.
Panic disorder involves these sudden, overwhelming episodes of fear. Some people describe it as feeling like a heart attack.
Wow, that's a lot.
Yeah, it can be really debilitating.
Are there other conditions where anti-anxiety medications might be prescribed?
Oh, tons. Generalized anxiety disorder, GAD for short.
I've heard of that one.
It's pretty common. Constant worry that affects pretty much every part of your life.
So it's not just feeling anxious sometimes, it's like anxiety is your roommate.
Ha ha, yeah, that's a good way to put it. And then there's OCD, PTSD, even some physical conditions where anxiety is a big symptom.
Wow, anxiety really does show up in so many ways. So if someone gets diagnosed with one of these conditions, is medication automatically the first step?
Not necessarily. Actually, our source makes a point of saying that for things like GAD, other approaches should be explored first.
Like what?
Therapy, for sure.
Yeah.
Relaxation techniques, lifestyle changes, exercise, sleep, all that good stuff.
So it's more of a holistic approach, like getting to the root of the problem.
Exactly. Meds can be really helpful, but they work best as part of a bigger plan.
That makes sense. Are there cases where medication might be the first choice, though?
Oh, absolutely. If the anxiety is severe, really interfering with someone's life, a doctor might recommend starting meds sooner rather than later.
Right. Makes sense. We talked earlier about dependence being a concern with benzodiazepines. Do you think that's still a big issue today?
It's definitely still a relevant concern, even if, the specific drug of choice might change over time.
So it's not so much about Valium or Xanax specifically. It's about, the class of drugs as a whole.
Yeah, that's it. Responsible prescribing is super important. And patients need to be educated about the risks.
It goes back to that open communication between doctor and patient.
100%.
So how would someone know if they're becoming dependent on a benzodiazepine? Any red flags to watch for?
Well, one big one is tolerance. Needing higher and higher doses to get the same effect.
So your body kind of gets used to it.
Exactly. And withdrawal symptoms, too. If you try to cut back or stop and you start feeling really rough, that's a sign.
Yeah, we talked about how those withdrawal symptoms can be pretty nasty. So how can we use these medications safely and effectively and, minimize those risks?
Honestly, it all comes back to good communication with your doctor, careful monitoring, being open to other treatment options, not just relying on medication.
Makes sense. And I guess there's no shame in asking for help in the first place, right? Anxiety is super common.
So true. It's nothing to be ashamed of. There are treatments out there that can really help. It's just about finding the right fit.
Speaking of treatments, our source mentioned something about microdosing benzodiazepines for long-term management. Is that a common thing?
Microdosing, it's a pretty new idea, and it's definitely controversial.
What's the thinking behind it?
Well, the idea is that you use these tiny doses, way lower than usual, over a long period of time.
And that somehow reduces the risks.
That's the hope. But it's super important to stress that this should never be done without a doctor's guidance. Seriously, never.
So not a DIY project.
Not at all. Okay, so we focused a lot on benzodiazepines, but there are other options out there too. Lots of alternatives.
What are some of those?
Well, one category is antihistamines. You've probably heard of Benadryl, right?
Wait, Benadryl, for allergies.
Yep. It's got this sedating effect, kind of makes you drowsy, and that can actually be helpful for anxiety.
Huh. So a medication designed for one thing can be used for something totally different.
It happens all the time.
So is using Benadryl for anxiety a normal thing?
It can be, especially for short-term relief. But there are downsides. That drowsiness we talked about. Not ideal if you need to be alert.
Yeah, probably not great for work or driving.
No. And it can have these things called anticholinergic effects.
Yeah, and cholinergic effects. What are those?
Okay, so basically, some medications block this neurotransmitter called acetylcholine. It's involved in all sorts of bodily functions. And when it gets blocked, well, you can get some unpleasant side effects.
Like what?
Dry mouth, blurry vision, constipation, sometimes even trouble peeing.
Yeah, that sounds awful.
Yeah, not fun. So Benadryl might be okay for a quick fix, but for long-term management, there are probably better options.
Gotcha. So what else is out there?
Beta blockers are another possibility. They're normally used for high blood pressure, but they've also been found to be good for anxiety, especially performance anxiety.
So like stage fright.
Exactly. Beta blockers block the effects of adrenaline, that fight or flight hormone. They kind of help to control those physical symptoms of anxiety.
So like your heart's still racing, but you don't feel it as much?
Kind of like that, yeah. One popular one is propranolol or Inderol. It's pretty well tolerated too.
Sounds promising. Any downsides to beta blockers, though?
Well, they're really good at managing those physical symptoms, but they don't really address the mental and emotional side of things.
So you might still feel anxious, even if you don't look anxious.
That's it. And not everyone can take them safely either. Like folks with certain heart conditions, asthma, or diabetes need to be careful.
Always talk to your doctor first, right?
Absolutely.
Okay, cool. So we've got antihistamines, beta blockers, anything else?
Our source also talks about clonidine. It's another blood pressure medication, but it can have some anti-anxiety effects. It works a little differently, though. It acts on your central nervous system, calming down that fight or flight response.
So kind of like taking a chill pill for your nervous system.
Yeah, something like that. It can really help with relaxation and reducing anxiety.
Sounds good. Any side effects to watch out for?
The usual suspects: drowsiness, dizziness, dry mouth. And be careful mixing it with alcohol because it can really enhance the effects.
No clonidine cocktails, got it. It's great that there are all these options, though, like beyond just benzodiazepines.
It is. That's the great thing about where we are with, mental health treatments today. So many possibilities.
And I imagine research is constantly coming up with new things.
Oh yeah, the field is always changing. What we know today might be totally different tomorrow.
That's both exciting and a little intimidating.
For sure. But the important thing is to stay curious, stay informed, and, be open to new ideas.
Wow, so many different medications to consider. It seems like we've barely scratched the surface. Is there anything else in the book that really stood out to you?
Yeah, actually. There's one more we should mention, prazosin. It's not actually used as an anti-anxiety medication.
Oh, what's it for then?
High blood pressure, usually. But get this, there's some really interesting research on its potential for treating nightmares.
Nightmares.
Yeah,
Really?
specifically those related to trauma.
Oh, wow. I can imagine those would be really rough.
Definitely. Vivid, disturbing dreams tied to a past trauma, it can be a huge problem for people with PTSD.
Makes sense. So how does prazosin help with that?
Well, it seems to block certain adrenaline receptors in the brain, which, kind of dampens that fight or flight response.
So even though you're asleep, it's like calming your system down.
Exactly. And it seems to be pretty effective at reducing the frequency and intensity of those nightmares.
That's amazing. Does it help with anxiety during the day too?
There are some hints that it might, especially for folks with PTSD, but more research is needed on that front.
I guess that just shows how much we're still learning.
For sure. It's fascinating to see how our understanding of the brain and these medications keeps evolving.
Yeah, it's a little overwhelming, but definitely exciting.
Agreed.
Well, I think we've covered a ton of ground today. We learned about how anti-anxiety meds work, the different types, the potential risks and benefits, and, most importantly, how crucial it is to work closely with your doctor.
Couldn't have said it better myself. Open communication is key.
And it's not just about medication, right? There are so many other tools and strategies that can be helpful.
Absolutely. Therapy, lifestyle changes, all of that plays a role. It's about finding what works for each individual person.
So true. And I think that's a great place to wrap things up. Thanks so much for joining us for this deep dive into anti-anxiety medications. It's a complex topic, but hopefully we've shed some light on it. What are your final thoughts?
Just that, knowledge is power when it comes to your health. Do your research, talk to your doctor, and advocate for yourself.
Great advice. And to our listeners, we'd love to hear your thoughts. Where do you stand on the use of anti-anxiety medications today? Are they overprescribed, underutilized, or maybe an essential part of addressing this growing mental health crisis? It's a big question, and there's no easy answer, but it's a conversation worth having. Keep exploring, keep learning, and most importantly, keep taking care of yourselves.